So, hi everyone. I'm Dr. Rena Chawla, faculty at Conceptual Obs and Gynae, and I'm very happy to have with me Dr. Gaurang Narayan. He's a student of mine at long time, actually, much before Conceptual, and when he was preparing for his NEET PG journey. And I've known him since then, and he has been with us for a long time now. And he has recently cleared his MD MS exams with excellent marks. I'm sure he's a gold medalist with the marks he's got. And he's also just written his MRCOG 2 part 2 today, and he's come for an interview. And he'll also be joining us as faculty at Conceptual OBG because of his keen interest in medical research. And we'll be seeing more of Dr. Gaurang on our app. I'm so happy to have you, Gaurang. So, welcome to Conceptual. I mean, welcome to the interview. And first introduce yourself, and then we'll take the discussion further.
Uh, Thank you so much, ma'am. It's my pleasure to join the team, and it's my pleasure to be here today at the interview. To my viewers there, hello, hi. This is Gaurang, and I recently graduated. I finished my MS from Indira Gandhi Medical College and Hospital, Nagpur. I did my UG from Indira Gandhi Medical College and Research Institute, Pondicherry, and
Indira Gandhi is
I
lucky for you, I think.
yeah, IGMC to IGMC. Just there
Yeah,
was a shift
yeah.
from Pondicherry to Nagpur, and I just have also cleared my MS exam, and I'm very happy to share with you all. Thanks to Raina ma'am that I'll be joining the platform soon, and we'll start the classes on Road to Research series from 17th. I would look forward to having you all there as well. Thank you so much, ma'am. And I have to tell this here that my journey with you has been long before, conceptual OBG. During the NEET PG preparation days, I would always join your free Kahoot quizzes. You used to host it in your Telegram group back then. Trust me, ma'am, OBGY, of course, I had interest in OBGY, but looking at people like you who made the teaching journey interesting, it made us realize that it's a very good brand for all of us. And thanks for also kindling my interest in into teaching. Thank you so much for that. And right from Kahoot days to then conversing with you on phone, and now to actually being interviewed by you, I feel it's come like a full circle. This moment for me. Thank you so much.
I'm so glad we were able to help you out, and we were able to inspire you. And it's because of students like you that we also get inspired to teach further. I remember you and a few other students were a regular in my quizzes and our classes and our even conceptual the case presentations. There are a few of you who would always regularly attend, and that really inspired us to that we're doing something good, and I'm glad we could help. So, Gaurang, could you just tell us about, so the one of the main questions we get is how, as a PG, as a postgraduate resident, especially in OBS and Gynae, a field which is extremely busy, especially in a government medical institute, how did you manage academics with work? So that's the main question I get. As first years, they're more into getting used to the environment, but as and when you become more and more senior and you get used to the usual routine, how do you find time to incorporate academics into your schedule?
Uh, Ma'am, when I joined post graduation in IGMC, the first year was very much hectic. Like there were hardly days when I would get out of the ward free before 1 a.m. or 12 a.m.
Okay.
midnight. And if we got free by 10 p.m., then it was like Chandi ke din. Arey wah, we are getting relief so early. So I think first year should it's okay if you're not able to allot time for academics. I think you should learn to acclimatize yourself with the environment first, your working protocols, because OBGY is a very dynamic field. And though there are guidelines in place, there is an institutional SOP which differs everywhere. Each
Yes.
hospital has their own protocol. It comes with their experience, their kind of people
True.
that they're dealing with.
True.
So acclimatize yourself with the protocols, because at the end of the day, I realized that it's not about you quoting the guideline, but if you even justify to your examiner stating that, ma'am, this is what we follow in our hospital, or this is our
Yes,
hospital
yes,
SOP to your externals,
yes.
I think they buy that argument. So that is also a learning. So as a learner, it is very important not to go back to text, but it's very important being a surgical branch to keep your eyes wide open, ears out loud, to be very observant in your servant. How is your lecturer holding the scalpel? How is a sister assisting? I think there are a lot of things to learn just by observing. So first year has to be completely, you should open yourself to exploring the branch, knowing more about your hospital protocols. Starting from second year, I would say you should start working. Uh, Trust me, people choose OBGY. In fact, even I thought so कि OBGY is all about probably what we read in NEET PG. मतलब ज्यादा से ज्यादा क्या है, बच्चा प्रॉब्लम है, टर्मिनेटेड सीजर कर दो, या problem is hysterectomy kar do. But it's actually not like that. It's
True.
a beautiful branch with a lot of dynamic physiology. The medicine part of obstetrics is interesting. The biochemistry part of reproductive medicine is very interesting, provided you read it from the right people and the right books. So what I would do is, ma'am, I have an entire library of all standard books, like Spurov, Tellins, you name the Bible book, and I would be
I'm
having
very
it.
glad. I'm very glad to hear that because books are our Bible eventually. I mean, it's very, very rare to see nowadays students to go back to read the books. And I always say that the books are the most important. I mean, you should build that habit if you haven't till now. Build the habit. Books are something which you'll always treasure. I still have my books from my postgraduate days, which is 15, 20 years back now. And I keep adding, getting the newer editions. And my, as you say, my OPD is like a mini library. So I'm very glad to hear that you have all the books.
Yeah, ma'am. And I also know how much, I mean, we both share a common liking of reading and
Yeah,
writing
yeah, yeah.
poetry and stuff. So I would say, even if you're not able to completely understand the textbook, the concepts behind it, you don't have to make notes of it, but at least read it like a storybook once to understand the flowcharts. That is very important. Luckily, my college, despite its busy schedule, they made sure that the second year and the third year students would should be relieved to attend the PG activities. Like Monday
Okay.
to Thursday, 1 hour we always had the PG activity. And I should thank my batchmates also, because the competition was so much between the eight of us in a positive way that iska PG activity अच्छा हुआ नहीं, मेरा ज्यादा अच्छा होना चाहिए. It was always there. So that was an
Okay. So
inherent
that's very
motivation.
important. That's very important. Yeah.
That inherent motivation was there. So then what we
And
did,
a healthy
I
discussion, like a healthy discussion is
uh,
very important. If you have something different or a different, rare case, discussing it amongst your peers really helps.
yes, ma'am. So any day I would see a new case, the first thing I would go is use ChatGPT. Like rounds mein someone is
Okay.
telling something. As a junior, apart from making notes of it, I had a small notepad where I would enter these important questions or points. Because it's
Okay.
very difficult for your professors to teach you something, but they ask you questions and leave that end for you to explore. So even if you have the bank of those questions, I think you will go back and explore them and try to make a concept clear for yourself.
Yes.
And from third year, once I got a little bit relaxed, free from the ward work, I started informing, like being the informing GR3. I allotted routine time for my reading. I would at least allot half an hour in a day. And in free days, during the free weeks, I would allot at least 2 hours so that I could go back and read. And during my third year, I have to tell this, there's not a single live episode of conceptual that I have missed. Like live
Okay,
classes are live
I'm very glad
classes.
to hear that because the live classes, how did the live classes help you? If you could elaborate more.
Ma'am, first of all, I don't know why I could easily connect with live classes, because I thought I was sitting in a classroom. And I'm a person basically of nature who likes sitting in a classroom and attending a lecture. But in PG days, you're not a student. Even your co-JRs become colleagues. They're no more your batchmates. So I think I related with the live classes because someone would type something in the chat box, someone would question it, and the way some faculty in conceptual, like maybe the discussions of JV sir, where he would give his experience, and Aditya sir, who would make it very fun. In a funny way, he would describe certain things in ways like what he used to remember stuff. making simple annotated diagrams of how we can reproduce in the exam. Those things made me actually attend. So even if I were on duty, and if I'm operating, I'm doing a cesarean section, I would ensure that I keep the phone on and the live class on and keep listening to it while I'm operating.
Okay.
In fact, this
Okay,
has
that's
happened.
interesting. People listen to
I,
music and you listen to our classes during surgeries.
yeah, I have done
That's
that.
nice. Nice
And
to know. Okay.
going back, I have taken notes of it. Third year onwards, I would say it's important that you make your concise diary. This
Yeah.
is what helped me because during the study holidays and just before the exam, when we just get one day intervals in between, it's very difficult to go back to textbooks, to guidelines, to
Yeah.
pointers
Yeah. Yeah.
because there's no one source which gives everything in a platter, ma'am. One of the reasons why I liked conceptual was as a user that if you talk of preeclampsia, different guidelines give different advices. You take steroid, for example. ACOG has a guideline, RCOG has a guideline. Someone says
Yeah.
39, someone says stop at 34. But all these controversies are what are actually tested in the exam. In fact, my
True.
long case, the recent controversies on tubectomy only were asked. Like, what would you do for
Okay.
a patient of hydrosalpinx, and why do you want to do salpingectomy for her?
Okay.
So all these points are actually discussed in platforms like Conceptual much better because out of experience, people are bringing multiple guidelines, multiple facets into one single platform.
True.
So
So
I
when we
liked it
prepare the
very much.
lectures also, yeah, so when we prepare the lectures also, it's like a learning experience for us also because to prepare one lecture on any one topic, even the smallest of topic, like I taken a class on episiotomy, you have to read a lot of places. What are the guidelines? What does recent evidence say? The different ways of suturing. How would you teach a resident how to suture an episiotomy? So it's all just a lot of research and study goes into preparing every lecture. So it's like we are also learning at the same time, and by teaching you, I mean, you get everything at one place. You don't have to go and read separately different books. Everything you will find at one place all together. That's how we plan our lectures. And I usually give the in every lecture of mine, you'll find all the references at in the beginning. I'll tell you this is my library where I prepared the lecture from. So if you want to go back and read yourself, you know which books or which guidelines or which online no, reading source you have to look at. So that's how we prepared the lectures, and I'm glad they helped you. Uh, so yeah,
Absolutely, ma'am.
yeah, and
For
one
exam,
Gaurang, yeah,
yes, ma'am.
yeah, sure, tell me, tell
Uh,
me.
no, I got reminded of this. I remember Aditya sir telling in one of his classes that एस्पिरिन के बारे में कोई भी पूछो तो बोल देना 150 mg. Like this was like a dialogue. And exactly my long case was pre-eclampsia. And
Okay.
people asked me about the aspirin trial. And one of the external examiners actually asked me, ki, Indian women are so frail. Why do you want to give 150 mg Hs? And I could just recollect the words. And I said, actually, ma'am, uh, you're right that aspirin can have its own side effects. Also, there could be receptor down regulation. They could People can turn resistant. That is why still universally we are not giving aspirin to everybody. But though the initial trial concluded that you can give anywhere between 76 to 150, but aspirin 2 trial concluded only with saying 150 is more powerful. So I would go by 150 only. So choti ho, badi
So,
ho, tall ho,
and
short ho.
Gaurang, my talk in AICOG on Sunday is on aspirin dose trials. So this is very nice hearing from you that you know all about the different trials. So that my talk is on all this. How did we reach 150, starting from 60 milligram? That was the initial to 75 to 81, and now 150 to 162 is what we have moved on to. So I'm so glad that discussion also helped you. That was asked in the exam. So it's
Yeah, I
very
mean,
important to be updated. So you're traveling, I understand. Just one last question. Do you need to go, or we can ask you
no,
one more
ma'am.
question?
Yeah, no, yeah,
Okay.
I can, yeah.
Yeah, so I want to ask you how did you prepare for the practical aspect, the Viva aspect? So the theory part is one thing. Also, for example, the case discussions. Apart from that, you have the pelvis, the skull, the different the instruments, the specimens. How were you preparing for that part of the exam?
Uh, my principal sources were three. One first from the app, like drug of the week, protocol of the day, labor room
Okay.
diaries. I
Okay.
followed all these short series and every reel, trust me, every reel. Like I think more than the app, I frequently used to open the reel because I have
On the
on my
Instagram.
Instagram, I've made a separate
Okay.
folder of reels called OBGY.
Okay. Okay. You can
And
do
there
that.
are,
I didn't know.
yeah,
Okay.
yeah, you
Oh, I
can do
had
that.
no idea. I had no idea. Okay. I'll try to exploring that.
Yeah, so there I have created a set of uh,
Okay.
reels from the
Okay.
conceptual platform. The second thing was the discussions, ma'am. Like I am in your discussion group also on WhatsApp, and I'm also in discussion group of Sir.
Okay.
Everywhere someone came up with a question or some UG student ended up asking a query. I've seen, in fact, we have also given our opinions. That's an open
Yes.
group.
Yes.
Unlike
Yes.
many
Yes.
people who keep the group closed, your group is an open group where even we could
Yes.
contribute from our experience where we got. So I have starred a lot of messages like that. So
Okay.
principally speaking, my main source of preparation was the reels and this, from which I had made a separate note. So I have a small
Okay.
notebook for
Okay.
practicals. I have labeled it like that.
Okay.
And the second thing was the PG activity in my college.
Okay.
Luckily, they helped us through it. In fact, our HOD, especially my mentor and guide, both of them conducted a series for the last few weeks on only table viva
Okay.
concept.
All right.
Uh,
Okay.
and the third thing is, I think, practical book, ma'am. I would recommend Birkud is a good practical book,
Okay.
I think.
Okay.
At least for
Okay.
Maharashtrian examiners, it was very good, helpful.
Yes. Yes. It's quite common in Maharashtra.
Yes, ma'am.
Okay, so that's good. Gaurang, just before we end, what are your future plans? Are you planning to write NEET SS, FET? Are you planning? I know you're writing MRCOG, but what do you want to do? Do you want to just give us an idea? Because this is another doubt I commonly get, ma'am. What after? And I have to do a session on this. What next? I'm planning the session next week probably. But what next? And what after finishing your residency?
Ma'am, definitely not NEET or INISS uh,
Okay.
because there are only two options, and I feel that narrows down my niche. Like
Okay.
only doing gynec onco surgery will make me stop
I
doing obs.
understand. Right.
I don't want to do that. I will give
Yes.
FET entrance exam, ma'am, because
Okay.
I think I personally like the like infertility,
Okay.
the laparoscopic
Okay.
surgery part of infertility, like
Okay.
tubal blocks or adenomyosis myomectomy and
All
stuff.
right.
So
Okay.
FET entrance I will give. Meanwhile,
Okay.
I don't know, somewhere my heart says that I should go and get some exposure abroad. I don't know.
Okay.
If I get an
So you're
opportunity, I will
exploring that. That's
that
good. Yeah, of
option.
course.
Yeah,
Yeah.
but I think I need to still fine tune my surgical skills. So definitely this bond period that Maharashtra I have to serve
To have a bond. Yeah.
would
Okay. All right.
I have a 1 year bond would probably help
Okay.
me explore other aspects
Yes.
of it. Yeah,
Okay. All right. So all the very best, Gaurang. It was a pleasure talking to you, and I'm so glad we could have you on board. And I think you can I mean, rest now. You must be exhausted. So
no, ma'am.
thank you so much.
It's my
Thank you.
pleasure to join you, and I must thank the entire platform. And like personally, I would like to mention uh, uh, Tejas sir because he answers every case like a student, and it makes us feel that this is how you have to answer in an exam. And sometimes the examiners put him in a spot also. They're like, why not this, why not that? But
True. He
he
maintains his
also
calm. So they
he
just
taught
had
us how to
volunteered
behave.
for a case presentation as a final year PG. He had volunteered for a case presentation. So we used to have these volunteers, whoever wants to present. So he had connected with me, "Okay, ma'am, can I present?" And he presented so well that I asked him later on, could you become like our model presenter for all future case presentations? So he said, let me finish my my MD exam, then I'll do all this. So we made him present all the cases because he's very confident and he is good at presenting, and that's what I want everybody to pick up the art of how to take a good history, how to examine, how to maintain calm, how to answer questions. So he's a perfect example of that.